Therese, maybe now we might talk about sexual health kind of like during the menopause. And I know this is of interest to an awful lot of women, because you were saying earlier how when our cycles get a bit erratic, that we still could become pregnant during that time. So, what should we do in relation to contraception or that?
Yeah, and it's something to be very aware of, because once you come into your 40s, the cycle can change. You can have shorter cycles, longer cycles. You can have months where you don't have a period at all, because there may be months that you're not ovulating.
Okay.
But of course, yes, you can get pregnant. And you were asking earlier about the length of the menopause. From a point of view of contraception, we would generally take that no period for 2 years before 50. Really, at the end of that period is indicative that you have come through the menopause. And after 50, 1 year with no period would generally indicate menopause. Now, we would still say continue to take precautions for a further year, just to be on the safe side. Or if a lady had the Mirena coil in place, you would say leave it for a further year before you remove it.
Okay.
So that would be, so from the point of view of contraception, whatever type of, it can be like for somebody who is, say, dependent on the Billings method, and once you get into your 40 with variable cycles, that's more difficult to actually know when you're ovulating.
That's the natural
charting
your cycles.
Charting your cycles.
Okay.
So that can become much more difficult for any ladies who are on the combined oral contraceptive. That can be continued until you're 50 years of age quite safely, if you're not a smoker and if your body mass index is in a normal range. So at 50 years, once you hit your 50th birthday, you've got to change. So at that time you can then change to the mini pill, which is the progesterone only pill, or of course the coil, which is also safe. So or a person may choose to just use condoms, but yes, even at this time a person could get pregnant, so has to be careful of that.
And is there, or would you recommend, like, is there a blood test that you can have to kind of show and prove definitively that you're no longer in danger? And I suppose I'm thinking of, as you were saying there now, about the likes of, if I remember correctly, that say the Mirena coil, which oftentimes you lose your period with anyway.
Yes.
So that's not the best indication for knowing if you've gone your year
Exactly.
or two without a period.
Yes. So I suppose if you've gone over your 50th birthday and you've got the Mirena coil in place, then you get your FSH level checked. And if that level is over 30, you get it repeated again in 6 weeks. And if it's also more than 30, that's pretty good evidence that you are out of the menopause zone, that you're not going to get pregnant. You would still be advised to continue with your Mirena coil for a further year, but you're pretty sure that you're well through the menopause. But that blood test is not used routinely. That's the one we spoke about earlier, because that fluctuates hugely, but it can be useful in that situation, just to sort of see the level is up and you're through your menopause, pretty much.
Okay. And when we look then at, you often hear people saying, and which is quite understandable, as you kind of outlined earlier, when somebody is maybe going through periods of insomnia, disrupted sleep, feeling anxious, whatever, and then we look at and we think about our partners and we think about our libido, and a lot of women often say, I'm just not interested, and I have heard some people say, actually it was never better. What's happening there, or is there anything that we can do to kind of...
Yeah, and again, the libido situation, of course, at this time, libido may be pretty much on the floor, like everything else, really. And now, in some cases, like HRT can help that situation, because you go on HRT, you're sleeping better, you're feeling better, everything else is better. The other thing, of course, is vaginal dryness that happens around time of menopause. That can also improve with HRT, but there are topical estrogens that can be used in the vagina that improve that situation, and that may help, along with lubricants and gels and all the rest of it. I suppose we're not in Ireland. I suppose we haven't really used testosterone terribly much, but there is a level of, as females, we have a level of testosterone in our body, which of course at time of menopause drops as well. Products in that regard in Ireland are scarce. The level of testing is probably not great, but in some cases using testosterone can help libido, particularly in the younger ladies, less than 45, where loss of libido can be a problem, or in someone who's had premature ovarian insufficiency. So in some cases, actually, the products used for men or can be used by, these topical gels can be used by ladies in a much lower dose, because if you use too much of this, and these would be rubbing on the product every 7 to 10 days, a little sachet of gel, and not overdoing it, because it can actually counteract the effects of estrogen and progesterone that you have in your body. But some people report good effects from the use of testosterone, but care has to be used with that.
Okay. And I suppose I'm thinking, as you were saying there, women that have an early menopause, now with women sort of having children maybe, or planning their families later in life, this can be a real problem, because at the very time they might still want to try and have children, or they're maybe in an early relationship or another relationship. This can be a real problem. How do you find that your patients, particularly the younger women, cope with that when they come to your surgery?
Oh, well, of course it's a problem. You're absolutely right, and people are pushing out the age of pregnancy all the time, and our obstetricians, if you're 35, you become an elderly prima gravida if you are getting so. After 35 years of age, this is our female biological clock, is ticking away quickly and gets even quicker. It is harder to get pregnant, rate of miscarriage is higher, and risk of problems like gestational diabetes and all those sort of things escalate when you become older. But having said that, lots of people get pregnant in at 40 or early 40s and have fine, healthy babies and very good outcomes. But of course it can be difficult to get pregnant, and that's a whole problem, and a lot of people fall into that category of late 30s, early 40s trying to get pregnant and boost it. So I suppose they're not even thinking of menopause, even though they're almost heading into the menopause range. But again, if a lady is 40 and periods are regular and she's very well, there's no reason why she can't get pregnant. It may take longer, higher risk of miscarriage, but there shouldn't be a problem there. For somebody who's already gone into menopause, flushes, blood tests would all be done at that stage, and it would be very worrying if the levels of FSH and LH were elevated in the blood. Those people would then be going to to see if the IVF people could actually help them.
Okay. So you touched on earlier there as well some kind of like vitamins and supplements that can help during this time. Is there any ones that you can kind of tell us for specific things, like we'll say flushes or sleep, and I know then there's the other range of we're worried about, our hair is getting drier and our skin is getting drier, what can help with these changes?
There are lots of things, and there are lots of different products that are tried. There's very little research to back the benefit of them. From the point of view of sleep, sleeping tablets and relaxers and all that are generally bad news. Any of those things are really, to be taken with great caution and avoided if possible. Melatonin, I suppose, is a natural sort of a product that sometimes can help sleep. And for somebody where sleep is a major problem. The products that are out there, black cohosh, and there's yams, and there's red wine vinegar and all sorts of things like that. If they make you feel good, most of them are not going to do you any harm at all. They're fine. They're not really going to have significant interactions, apart from something like St. John's wort, which can interact with things.
So what should we watch out for there? What would that interact with? What other sort of medications might somebody be on?
If somebody was on antidepressants long term, Or again, now we don't have too many people in this age group on warfarin, but certainly with warfarin would be one that is I, before I check anything, I would just check back with your own doctor in relation to taking these products. Usually they're fine, not great benefit to be had from them according to the research, but some people feel better taking them. Now something like the B vitamins or the oil of evening primrose are totally safe and do help sometimes, like especially the oil of evening primrose, long time around, doesn't do any harm. But just if there's any sort of freaky new ones, and there are ones all the time being sort of coming on the net and that, I just check just to see what's in them. Usually they're fine.
So really to check in with your GP
just
next
check,
time.
Especially if you're on, if you are on long-term medication, just go and have a chat. Because again, you may be treating symptoms that you think are menopause and they may be related to something else. Because I suppose around this time, we didn't mention it, but you know, if you get into your 40s and you're feeling unwell and your friend says it's the menopause, it may not be. So you really do probably at that point need to go and just get a basic blood check-up, just to check, because thyroids are, underactive thyroids or overactive thyroids, which cause flushing, weight loss, anxiety, and mimics an awful lot of the symptoms of menopause. So you want to be sure you're basically healthy. And another, I mean, obviously, like, we need to be at this time checking just to make sure sugar is good and the cholesterol level is good, so that you're having yourself as fit as you possibly can, and you're not sort of saying, oh, it's the menopause, what can I do? Because you can always do lots to keep yourself healthy.
I suppose, personally speaking, I found I got a lot of tension headaches, and when I gave up caffeine completely, they went completely. Is there any kind of anything in that?
Yeah, there would be, because even with some of our poor menopausal ladies trying to stay awake through the day, they probably have gallons of caffeine flowing through their veins,
and the Diet Coke,
and the Diet Coke, and Red Bull maybe,
yes.
as a total fails. Yeah, so you can start poisoning yourself. So yeah, it's of course as part of just really, having a good diet, and sort of trying to go with sort of natural and good things, and moderation. Like, so too much coffee, bad. I mean, it's a stimulant and all the rest of it. But yes, you're absolutely right. It can cause headaches. And again, of course, you need to check your blood pressure as well and all of that. But that's as part of your overall check at this time, just to make sure everything is okay.